Hello and welcome to The Wizard and the Priestess. I am Nuala, my co-host is Matt. We are
Wizard and the Priestess.
rocking out today because it is episode number 17 and we are very excited to jump straight in. We are going to be moving into chronic diseases, and we have been touching on this in the last few episodes. Episode 15 we really got into the thought process and the implementation of how we think and how that can turn into dis-ease, and really learning what we need to do in that. And then last week...
Yeah, it's how the psyche is mirrored in the body. So the disease gets physically manifested.
Yeah, cool. So just reiterating that, episode 15, we really talked about how the psyche is manifested in the body. And it can be manifested in both ways, but we're talking about it in the disharmonious way.
Yes.
And then also last week we kind of went on a bit of a tangent last week, talk about
sounds about right.
a few different things,
yes.
But essentially started to touch
flowed.
on this idea of how disease comes about and how it impacts us. And then, this week we are going to dive into...
Going a bit deep this week.
Yeah.
So we're touching on cancer, diabetes and heart diseases.
Maybe we won't though.
Maybe we won't.
So let's not say what we're going to do. Let's
go
just
in
say
alphabetical order.
we're going to be talking about chronic disease today.
Right.
So we'll just see what comes through in that, because we don't know exactly where we're going. Exactly. I think I want to cut that out, Paris. If you can cut what we've just spoken about out, that would be fantastic.
Give it a clap.
Give it a clap. Okay, so today we're going to be talking about chronic disease.
Mm-hmm.
And so, Matt, I'm going to throw it to you. What is chronic disease?
Chronic disease, by definition, is a daily, discomfort, or a daily being affected daily by a disease. So chronic means daily. Up until then, it's acute. But it doesn't turn...
Hang on. Acute could happen. You could feel daily too.
Yeah, but the length of the definition of acute only goes for about 60 days. Okay. Then it turns into chronic.
And then it'd be impacting us daily.
Yes.
From that point on.
From that point on, yep.
Feels pretty quick to turn chronic.
Mm.
Okay, but then if we're going to go deeper and we're going to talk about cancer, I know you've touched on this before, but how long does cancer take for a adult human body to kind of become cancer?
So with cancer, first of all, we have to get logic out the window. Cancer and logic don't go together, because sick people get cancer, healthy people get cancer, kids get cancer. So there's no real logic to that. To get cancer, as most people would know and think of it, is anywhere from 10 to 15 years.
So it takes 10 to 15 years to actually...
To get the diagnosis of
typical
cancer. Stage 4.
Oh, stage 4.
Yeah, so that's typically the terminal. With that said, depending on the person, they can show up with symptoms earlier, like stage 2, sometimes even late stage 1. So with those people, they've just gone, usually they're the people who've gone in for a routine checkup and someone's found something somewhere. That's usually the earlier stages. But it won't usually, depending on what cancer it is, it won't usually show up as cancer till late stage 2, 3.
Okay, so we won't actually identify it as cancer until you are at a stage 2. And what does that actually mean?
Well, you'll start feeling symptoms. So low of energy, you'll feel very, very tired, very, very sick, might have a lot of pain. Things that are seemingly unexplainable, and they don't make a lot of sense. So if you have a tummy ache, that can be 1,000 different things, right? You've gone, had all the herbs and the medications and whatever else, and nothing's really changed it at all. That's a classic sign of a cancer patient or a cancer condition.
Yes. Okay. And when we think about treating cancer, how do you treat cancer?
That's a big question. It's really different. There's no cookie cutter. Think of a role of a cancer cell. The role of a single cancer cell is to consume sugar to manage chaos in the body, because excess sugar means excess acidity. Cancer thrives in an acidic environment. So the way I would explain it to someone would be, if you had garbage on the street, you need a garbage collector. Now, in a fairly quiet street, one garbage collector can typically do the job and it's all gone. However, there's more and more garbage on the street, and it's a busy street being the immune system, then you need more and more garbage collectors to pick up the rubbish. Over time, they multiply and they can essentially overpower the garbage. So there'll be too many garbage collectors.
This is really cool, because I have a really interesting analogy that I was taught somewhere along the way about garbage collectors and what the function of medications tend to do with these, specifically for immune diseases. And what we do is we give these medications, and what those medications do is essentially take away the garbage collectors. So what we then do, we've got this body that is acidic or might not be functioning to its optimal potential, and we then give these medications that block the garbage collector from coming. And so you still get the garbage, and imagine the people living inside the house go, okay, well, we don't really want the garbage in our kitchen. Let's just we'll go and put it in the hallway. And then slowly every afternoon, every day after food or whatever you've been doing, you sweep up the floors, there's garbage, you finish your food, it's garbage, and you put that garbage and you start putting it into the hallway. Then the hallway's sort of full, so then you start filling up another room, and then you start filling up the next room. Yeah. And the only issue is that the garbage collector's gone. And so essentially that's the problem. And that's what the mechanism of most medications is doing, is actually blocking the garbage collector from doing his job, which is like helping, which would essentially help in reparation. But when we think of that analogy, it gives us a pretty nice way of looking at how holistic medicine might work, in the way that we might increase the garbage collection instead of blocking them from coming into the house. Yeah,
getting the garbage collector to do its job.
Right, and imagining that our bodies want to find balance, so they are constant, like our body is trying to find a way.
24/7.
So if imagine that way in this analogy is the garbage collectors, and they keep knocking on the door. And you're like, no, but they're knocking on the door. You might not be saying no to that. You might be like, yeah, come in and collect the garbage. But the medication you've taken has made that door Fort Knox. It's like a metal door that's been like welded shut. So there's no way they can actually get in.
Or it may have even cut the legs off the garbage collector. So it's essentially disabled the garbage collector to do its job.
Shit.
Saying. Anyway, back to your question.
That was really morbid.
What I would do.
I'm just seeing this like poor garbage collector pushing himself.
It's only an analogy. Relax.
You mean you can't go there? Like, this is.
Anyway, back to the question before I was rudely interrupted
the
there.
Garbage collector lost his legs.
He's fine. I've checked him out. He's good.
Okay, so
the garbage collector can grow his legs back.
Fantastic. Okay, so his legs are only just stuck outside.
Interrupted.
Oh my gosh. and then I just wanted to say that when you stop a medication, it doesn't just open the door. The door just doesn't unweld itself and get released, and the garbage collector can come in now and clean out the house of all the rubbish. It takes a lot of time for your body to find its balance again. So your body might send a couple of extra garbage collectors to open. Especially if one of them doesn't have legs.
You're making it weird now.
Nope.
So anyway, what I would do with a cancer patient, it would depend on what kind of cancer they had. because cancer itself is the division of abnormal cells.
Yeah, the uncontrolled proliferation.
So, like we said in episode 15, what directs the direction of the cells? It's the thought.
Mm-hmm.
So, I want to know what created that condition for those cells to do what they're doing. And depending, obviously, where it's at, that's the theme of the cancer, and it's usually the pattern that they have in their life. So they've suppressed a thought / emotion, and then you include environmental toxicity to that. So all the hormonal disruptions going along with that, which also suppress the immune system. And then before you know it, you add bad diet onto that, poorly designed exercise program, lots of stress, lack of sleep. And usually they don't have a lot of joy in their life either.
Yeah, because joy essentially is the the most important ingredient to feel love, and love is is what makes life go around.
Well, it's the driver of a lot of the things that we do.
Yeah, powerful. And so I've just been diagnosed. I've got stage 2 rectal cancer. They've told me I need to have, essentially, I can have my bowel resection and potentially have a colostomy bag, and then I need to do 10 rounds of chemotherapy, and that is my option.
Mm-hmm.
And I've arrived at your desk. What would you do?
I'm going to say don't stop doing anything. I'm not that guy to suggest anything other than what you're doing, but I want to know how safe do you feel in your life, especially prior to knowing about that, because that's where we hold the energy of that idea. So do you feel safe? Do you feel secure? Who's your tribe? Do you feel safe within that tribe? Do you feel financially secure? All of these little things, that's where we hold those ideas. And in our society, if you're living a life where you feel you can't express yourself, you can't express your fears, your concerns, or even celebrate your wins, that all gets suppressed, and that becomes pressurized, and that becomes concentrated into a certain part of the body. That part of the body happens to be the antenna for those psychological themes. So I would have that discussion. And then I'd want them to see like an integrative health practitioner to do whatever they can to support that process as well. So that's what I would do. Same question.
Yeah, I think that I would first of all just be checking in with what's going on energetically in their body from my perspective, to do all the normal, as if we had no diagnosis, and just check in and see what was identified, because it's never missing. It's always glaringly obvious that something's unwell. And then I would do like just a normal intake, like you would do with any other patient, and then from that point I would treat them as if I would treat them like any other person. I would recommend all the things that I would recommend, and then I would be, you make your decision and you choose your path, being mindful not to get hooked into these ideas, because that is the kind of demise sometimes. It can add to it.
Sure.
When you have hooked into something someone has told you, and now you're creating a thought pattern.
Yeah, because the word itself is correlated with death straight away. So yeah.
And on that, I would just say that there are cancer. Oh man, what is cancer? Cancer is like a overgrowth of cells that aren't meant to be there.
Yeah.
They're like, yeah. Let's just speak it in real layman terms there. But that's happening all the time.
We have cancer in us all the time.
All the time.
Yeah.
And we can call it cancer, or we can just call it the breakdown of, the immune system function of like repairing and releasing and transforming and transporting the waste of our body, giving us the good and maintaining the good chi, and releasing and clearing out the bad.
Yeah.
And so it's that function of transformation, transportation.
So the early days of cancer is actually a protective mechanism. But then, it's in a bit of a paradoxical way, the more protection you need, the less protection you have at the cellular level.
Yeah.
So that's where kind of cancer becomes illogical, because you can't, I think statistically today, 2 in 3 people will get cancer.
As in a diagnosis from a doctor.
Yeah.
Yeah. So
back in 1900, it was either 1 in 100 or 1 in 50.
Do you think that might be because we are living longer?
I think it's the environmental factor more.
Yeah. I mean, I only have to look at the patients that are in my clinic at the moment and to understand that if I have sort of women coming in every day that have dysfunctional periods,
Yeah.
Dysfunctional sleep, dysfunctional connection to self, dysfunction like that, and they're young.
Yeah.
It's a very clear indicator that there's something amiss.
Absolutely. And the introduction of pesticides to our foods post World War II, I think it was, that it's skyrocketed since then. I don't think that's a coincidence.
And I would say along with that is the dissipation of community. We now have to seek belonging.
Yeah.
It's not just there and available to us. And I think, like, if we think about it in terms of love and connection, it's like our number one driver. It is, however, coming back to that cancer being illogical, there are people in my life and world that if we looked at their diet, their exercise regime, their everything bar their own sense of self is actually, if we're scaling everything on 1 to 10, 1 being abysmal and 10 being optimal, they would score, say on, they would score the lowest of low, except for self-preservation.
Yeah.
And that would be a 10.
Yeah.
And maybe the next person has like low self-preservation, low like self-belief, but everything else is optimal.
Well, it's where it shows up in the body. That's the biggest clue. So think about think about the chakras, right? Sense of self that we spoke about in our series.
About 3 episodes ago, 4 episodes.
Home of the self, pancreas,
Yes.
right? 3rd chakra. It's our digestive center. We had a digestive system before we had a brain. So our sense of self, any disease in that area of the body gets really aggressive really quick. So pancreatic cancer is one of the worst ones you can get. The show's over pretty soon. Think about liver cancer, sense of self again. Stomach, same thing.
So when you're saying that, I want you to touch on now how sense of self. So how would one kind of ensure that isn't overgrown, or how would one work on that particular aspect of like the spiritual psychic aspect?
How they would work on it?
Yes, to ensure that they have a good sense of self.
Well, firstly, it's knowing the self, knowing who you are. That includes all the good stuff and all the negative stuff. You've got to own your shadow as well, because these things are largely unconscious.
Yeah.
So the first step is really getting to know the self, which is the person in the mirror. Then it's accepting that person unconditionally and really loving that person as well. Now, we all fuck up from time to time, but it's not bashing yourself up for it. If you say something mean to someone, that'll likely play on you more than them. Could be vice versa as well, works both ways. think of something you did at school, for example, that you weren't proud of, but you didn't know any better at the time. You were just trying to fit in, trying to be cool, whatever. But now you're older, wiser, you've had more life experience. Then all of a sudden that memory pops up. Oh, I really shouldn't have done or said that. And it just starts to eat away at you. That's really the seed for it. So it's knowing the self, accepting the self, and then really realizing that, because when we know the self, accept the self, that itself can be quite isolating. And if the last 3 years has taught us anything, is that there's been a huge division of people. You're either this or you're that. So it can be quite isolating, which can damage the self even further. So knowing the self, accepting the self, and then realizing that that self is connected to a greater self, which is the collective. We're all connected.
Which is the whole.
The whole. So that's really the springboard, but that requires consciousness and perception going from the self center to the heart center. Then that's a springboard into a spiritual, more of a spiritual reality, if you will.
Yeah, and what you're saying from my perspective is kind of like the 7 Po and the 3 Hun, which is essentially what is given to us, is created for us. So the 7 Po you would see as the shadow self, and the 3 Hun you would see as the those kind of like the gentlemen, the like those like, oh, I love that about that person.
Yeah, okay.
I love that they are.
Yeah.
I can see that in them. That feels so good.
Yeah.
And so when we were created when our soul contract maybe was received into the body, and like I've kind of talked about, it's like imagine in this nectar cup of like the mother and the father. Here's the nectar of you, and then it's poured into the increments of your of your spinal column to kind of, okay, this is, maybe you got a little less in the pancreatic area because that is your Po this lifetime.
Right.
And that being that...
Is that like a karmic?
Karmic maybe, but more like, I'd say it's not necessarily karmic.
Yeah.
It's sort of like we've spoken about in a few episodes a long time ago, is more about, okay, this is your soul's contract.
Sorry, I meant pre-incarnative choice, not karmic, yeah.
Right, yes. More, yeah.
Okay.
So, yeah, absolutely. So it's like that idea that, okay, now we're here and this has been poured into my lifeline for this life in this human body. And so that is not to say that you were then poured, minimal energy into a particular spot, and therefore that is why you had cancer. And that would be more looking at that kind of, I believe, a simple, very simplistic way, which we in Western medicine love simple. And so that is where DNA and genetics, right?
Yeah.
Let's isolate this one chromosome that says this one thing about this whole human, and therefore we should cut everything that is related to that thing out so that they never get some form of chronic disease and illness.
Yeah.
Whereas from my perspective, it would be more that, well, I think the holistic aspect is more of the epigenetics, which is so much more correct in a sense that you get given you get given this nectar, but if you can understand self and understand what that shadow is actually teaching you, you move through that and move up the chakra, or you move through that and create and receive the gift of that knowledge that you're here to receive.
Yeah.
Shadow and Hun, or Po and Hun, I don't know, what's the opposite of shadow? In
Light.
like light, right? Obviously. But
Wow.
yeah. Anyway, special.
Pregnant. As well.
Yeah, pregnant. But yeah, that light and shadow, right? So that would be, the shadow would be seen as the Po from a TCM spiritual perspective, and the Hun would be seen as the light.
Yeah.
And so when we look at that, those aspects of understanding self from that dynamic and that perspective is like, there's always a gift in the shadow.
Yeah.
There's always a
There's
gift
always
in that Po.
at least a lesson.
That's what they're there for. That's this lifetime of growth. We have brought ourselves here. That is what we're here for. And so I don't know if I confirmed that it's not that you are You are not given a death sentence when you arrive here. You are given a life story or a life experience. And you choose how you do, what you do with it. And for some of us, that's, I imagine there's, some really, really tough lessons that are either trying to be learnt. I do want to touch on quickly about childhood cancer and that being a chronic disease. I know that we have lightly touched on it once before, but I just wanted to get you to just touch on those years and what that might mean and those things.
Yeah, so again, this is where logic can be sort of all but thrown out the window, particularly from a medical viewpoint, from a left brain viewpoint. Here's where we need to transcend that and include the bigger picture. So if we're getting rid of earth logic, there is a case with childhood cancer. There's a case you can trace the nutrition back through the parents and that lineage. There could be something there. I worked with a couple of years ago who were very, very open-minded and asked me to, lack of a better word, spiritually investigate what was going on, because their 2 or 3 year old got diagnosed with cancer. And when I investigated that, it was the sole contract of the child to get cancer. And when the child died, it brought the whole family together, who had all but split apart. So that was the contract. So again, doesn't make earth logic sense. But from a soul, universal perspective, you can hopefully see how that sounds like a movie script, but how that could be a thing.
Yeah. And we've touched on before, there's a certain, when it comes to those early childhood chronic illnesses, that was it up until about 10 years old, that energy essentially is from the prenatal chi?
Yeah, 7 to 10.
7 to 10.
Yeah, that's the biggest imprint. So our deepest imprint into our unconscious comes before the ages of 7 to 10.
Oh, okay. So when you're talking of that, so you're not actually talking about children, or it could be both ways. So whether the illness is parentally related or they're prenatal chi related. So what was poured into that cup when they were conceived.
That'll typically express itself by then.
But before 7 or 10 years old. Yeah. However, what is really interesting too now that we know, or at least I believe, that those first 7 years are so important for the trajectory of life.
Yeah.
So that unconscious program that has been set upon the child in those first 7 years is essentially going to set up, and Gabor Mate talks about it quite openly and strongly, about the research that is quite clear of the illness or disease that will manifest later in life, depending on how those first 7 years have been experienced.
Yeah, because we wear it. We're a sponge in those years. We need to be. And whatever, that forms the basis of our beliefs. And our beliefs essentially determine the behaviours of life. Our spiritual beliefs navigate us through life, and that ultimately directs an outcome. Yeah,
which just reiterates for me time and time again the importance of the preconception and how it is not just about making a baby, it is about making a life and being conscious that what we are doing is in the best, is not just, I know personally the feeling of wanting a child and wanting a child tomorrow, and I have definitely done a lot of work. I've sat in a lot of mud to try and, work it out prior to my first child's conception. And slowly I chipped away at all this doing and landed into my feminine and realised, I need to do less. It's my partner that needs to do some more doing and I need to do some more resting and some more being.
Yeah.
And when we kind of got that and aligned that, well, things just lined up and we made a baby. And now this has made a third baby.
Yeah.
And it's just, my mum once said to me, I was like, it's really important, preconception's really important. And she's like, you've been focusing on preconception like 10 years prior to your like you
Yeah,
first conceived
Yeah.
a baby. And I was like, oh, thanks for seeing that. But it is true, because I was very conscious of being somewhat the best of my ability. In saying that, I remember, I distinctly remember feeling I was vegetarian and then turned vegan for a time. Vegan, I will use that word very lightly, because if I was having pizza, I would have cheese. So definitely I was a vegan. But either way, I was vegetarian, and then at home we definitely ate very holistically from a vegan cookbook, essentially. But I remember feeling suboptimal, and I remember saying to my friends and my partner, and we would I would say that it's okay right now to be in this way. For me, I felt like I was sacrificing my holism and my feeling of 100% wellness for those that were like a lower sentient being than myself.
Yeah.
Now I'm more aware of the importance of that holism all the time. Without you being in the full power seat, then you are not actually helping the universe or the earth or your own self.
Yeah.
And so now I can see that. And now it's so important for me to feel really well. But that really, really landed when I fell pregnant. It was like, it is me that needs to be 100% so my children or child at the time can feel 100%.
Yeah.
And so that is such a reminder for everyone that the preconception is really important. You feeling 100% is really important. And if you don't feel that way, to be really conscious.
Well, it's going to be imprinted onto the child, because the child will be tasked with the unmet lives of the parents. Carl Jung said that. So how it's quote unquote supposed to work is where you let down, the kids will pick up and take it and
Keep going.
and do it better, or keep going with it, or however that works. But if you have whatever you have unhealed in you, they're likely going to inherit and live out in their life in an attempt to heal you.
Yeah. And which we could see as their right?
Yeah.
So we're always going to pass something like that on to a child, where we're like, oh, damn it. I see that in my own kids sometimes. I'm like, oh. Me and my partner sit in bed sometimes, but we kind of compare. He's like, if that kid's me, then that kid's you, right? And I'm like, well, no, it doesn't work like that. They're both of us.
Yeah.
But it's a really clear thing for us sometimes, where we look at our kids and we're like, I just see a little me. I see her playing out the things that I didn't feel as a child. And she's playing it out again. And she's like showing us. And I'm like, oh, man.
I think kids show us how to be kids as well, because we lose that as adults.
Yeah.
If our inner child isn't nourished, it comes out unconsciously, usually as a tantrum of some sort.
Totally.
And we've suppressed it for decades at this point, and then someone cuts you off in traffic.
Yeah, I've seen your tantrums, mate, and they're like...
It's my healthy outward expression
of those inner children.
Of my inner child.
That are still working on themselves. And I think that's really important. Let's bring that all the way around back to that chronic illness idea and disease idea, that is one of those things that can really help us come back, is the joy that we can create within ourselves, and the happiness and the play, and coming back to those childlike states that are just free and soft and just flowing.
Unbound, there's no objective to it.
Yeah.
It's playing for the sake of playing.
And screaming and tantruming for the sake of releasing.
Singing, dancing.
And accepting all of what is.
Yeah.
The full expression, the full spectrum. So I guess is there anything... So I guess the one thing that I did want to touch on is... So obviously, as holistic health clinicians as we are, we tend to stay away from directing patients in any way or form if they've been prescribed a medication. From my perspective, that's something you take with your doctor, because that's their therapy, their focus. And then I'm just going to focus here. And then I will plant seeds and remind a patient of the questions they can ask their doctor. And then I do cross-referral with doctors and have conversations with them about, okay, this is what I'm doing. And sometimes they work with me, and sometimes they just receive the information and it's too far out of their understanding, and that's okay too. There is this aspect that would you say that a medication in terms of treating chronic disease like cancer can do more harm for a person than good if we're essentially taking away the garbage
Absolutely,
collector?
it can, because firstly, we all have our own unique biochemistry. So we can eat a banana and have two completely different reactions. So they give the same medicine to all the people who have that specific diagnosis. How could you possibly know how they're going to react? Because a certain research study with X amount of people, 65% got better. That could be from anything. I'm not discarding medicine or any medication, but as long as for me, if the client is consciously aware of, the potential outcomes, good and bad, then I'm fine with it. So a lot of people will come to me initially with all these kinds of symptoms. I'll ask them if they're on any medication, and they'll say yes, no, whatever it might be. And I look up the medications and the side effects, and they're actually coming to me because they're experiencing the symptoms of the medication that they're on. So one medication is going to mask something, but then it creates something else. So they're coming to me for that. And then we have to have that discussion. Well, why did you get that? Why are we taking that? And then go back as far as we can. So as far as it can create damage, of course it can. Can it be beneficial? Absolutely, of course it can. But I'm more interested in, well, why do you need it in the first place? What were you doing that's so out of alignment with yourself that created the condition for that to start? And again, it's largely unconscious. So if you're not sure what your unconscious is doing, take a look at what you're creating in your life. It's mirroring itself back to you. So unless we meet it from the inside, it's going to meet us from the outside.
Yeah, it's really powerful and a really important aspect to consider when we just start taking a medication, whether that is for something like chronic disease where we've gotten to this point, we're maybe 10, 15 years into the red.
But we just know of it at the moment as an itchy bum, as an example.
Oh.
That's all we know, not me. I'll just give an example.
Okay, so you got that itchy bum out there, just be really conscious.
It can be a headache, it can be dandruff, it can be an earache. Whatever it is, it can be a sore tummy. It can be anything.
Yeah.
So that's when most people start investigating, because that's when it's been made into conscious awareness. But it's been there for a long time.
Yeah, and I would just touch on this idea of the process of, we did touch on it in, I think,